You've just been told your newborn son has an undescended testicle, and you're probably thinking it's a minor thing, something that will fix itself, something you can just wait out, but right now, there's a clock ticking that almost no parent knows about, and missing this window could affect your son's ability to have children of his own someday. Let me walk you through exactly what an undescended testicle is, why wait and see can be the riskiest advice you'll ever get, what the actual treatment window is, and the fertility risk that makes this so much bigger than a minor anatomical detail. Let me share a clinical scenario based on real medical experiences. We'll call this Mom Amanda. Amanda's son Jackson was born at 39 weeks. Healthy, beautiful. During his newborn exam, the pediatrician couldn't feel a testicle in his left scrotum. The right one was there, the left one wasn't. She said, "This is very common. Most of the time it comes down on its own. Let's just watch it." Amanda heard "very common" and "most of the time" and stopped worrying. She figured it would resolve. At Jackson's 2-month checkup, the testicle still wasn't down. Same at 4 months, same at 6 months. Each time the message was the same: let's give it more time. When Jackson finally saw a pediatric urologist at 14 months, the urologist was direct. "This should have been addressed months ago," she said. "The testicle needs to be brought down surgically, and the longer we wait, the more we risk permanent damage to his future fertility." Jackson had the surgery. It's called an orchidopexy. At 16 months, it went well. The testicle was brought down and secured in the scrotum. But the surgeon noted that the testicle was smaller than the right one, and the tissue quality suggested it had been in a suboptimal environment for too long. Whether Jackson's fertility will be affected remains to be seen. He'll need monitoring as he grows. Amanda later said, "I wish someone had told me there was a timeline. I thought waiting was the safe choice. Nobody explained that waiting too long was the risk." Now let me share a different scenario. We'll call this Dad Kevin. Kevin's son Marcus was born at 36 weeks, slightly premature. Both testicles were undescended, but Marcus's pediatrician was proactive. "Because he's premature, we'll watch for 6 months," she said. "But if they're not down by then, we're referring you to pediatric urology." At 6 months, one testicle had descended. The other hadn't. The referral was made immediately. Marcus saw the pediatric urologist at 7 months, and surgery was scheduled for 10 months. The orchidopexy was successful. Today, Marcus is 6 years old. Both testicles are in the scrotum. Follow-up ultrasounds show normal growth. His fertility prognosis is excellent. 2 boys. Same condition. One outcome clouded by delay, the other protected by timely action. The difference was a parent who understood the timeline. Here's what's actually happening inside your son's body. During fetal development, the testicles form inside the abdomen, near the kidneys. Around the 7th month of pregnancy, they begin a journey downward through the inguinal canal into the scrotum. This descent is guided by hormones and a complex developmental process. When a testicle doesn't complete this journey, it's called cryptorchidism, an undescended testicle. This is the most common genital abnormality in newborn boys. It affects about 3% of full-term male infants. In premature babies, the rate is much higher, up to 30%, because the descent happens late in pregnancy. In some cases, the testicle is truly undescended and remains in the abdomen or inguinal canal. In other cases, it's what's called retractile. A retractile testicle has made it to the scrotum, but a hyperactive cremaster muscle pulls it up, especially during examination. A retractile testicle can be manipulated into the scrotum by hand and typically doesn't require surgery. A truly undescended testicle cannot be brought down manually. Here's where the timeline becomes critical. If a testicle is undescended at birth, it may still descend on its own during the first few months of life. This is most likely to happen by 3 months. After 6 months, spontaneous descent is very unlikely. Current guidelines from the American Urological Association recommend that if the testicle hasn't descended by 6 months of age, surgical correction should be performed, ideally by 12 months and definitely by 18 months. Why this window? Because research has shown that beyond 6 months, the undescended testicle begins to show progressive changes. Germ cells, which are the cells that will later produce sperm, start to decline in number. The longer the testicle remains in the warmer environment of the abdomen or inguinal canal, which is several degrees warmer than the scrotum, the more damage accumulates. This damage can affect sperm production later in life. This brings me to the hidden risk that most parents never hear about until it's too late: fertility. Men who had an undescended testicle, even on only one side, have a higher rate of infertility than the general population. Studies show that about 10 to 30% of men with a history of unilateral undescended testicle have reduced sperm counts. For bilateral undescended testicles, the impact on fertility is even greater. This is because the undescended testicle often has impaired germ cell development, and even the descended testicle can sometimes be affected, possibly due to shared underlying factors during development. But here's the hopeful part that every parent needs to hear. Early surgery, orchidopexy performed before 12 to 18 months, has been shown to improve fertility outcomes. The earlier the testicle is brought into the scrotum, the better the chance that sperm-producing cells will develop normally. Studies comparing boys who had surgery before 1 year of age to those who had it later show significantly better sperm counts in adulthood in the early surgery group. There's another risk that deserves honest discussion: testicular cancer. Men with a history of undescended testicle have an increased relative risk of developing testicular cancer later in life. The risk is about 2.5 to 8 times higher than men without the condition. It's important to put this in perspective. Testicular cancer is rare overall, and even with an elevated risk, the absolute risk remains low. But it's real, and it's another reason why bringing the testicle into the scrotum is important. A testicle in the scrotum can be examined for lumps. An undescended testicle in the abdomen cannot. Early surgery reduces the risk of cancer somewhat, but even after orchidopexy, regular testicular self-exams starting in adolescence are recommended. Now, before I give you your action plan, I want to pause for a moment, because if you're holding a newborn with this diagnosis right now, you might be feeling overwhelmed. Surgery on your baby boy, worries about his future, questions you haven't even had time to form. Take a breath. You're not behind. You're asking the right questions right now. And the fact that you're watching this means your son is already on a better path than if this had been ignored. Let me give you the action plan. Step 1. At every well-child visit during the first 6 months, ask the pediatrician to check the scrotum. Document whether the testicle is palpable, whether it's retractile or truly undescended. If the pediatrician can't feel it at all, an ultrasound may be ordered, but a referral to a pediatric urologist is the definitive next step. Step 2. Understand the difference between retractile and undescended. If the testicle can be gently pulled into the scrotum and stays there briefly, it's retractile. This usually doesn't need surgery. If it cannot be brought down at all, it's truly undescended. Only a physical exam, and sometimes examination under anesthesia, can tell the difference definitively. Step 3. Know the timeline. If the testicle is still undescended at 6 months, the time for watching and waiting is over. Schedule a consultation with a pediatric urologist. The surgery, orchidopexy, is ideally performed between 6 and 12 months and definitely by 18 months. Step 4. Discuss the surgery with the urologist. Orchidopexy is typically a same-day outpatient procedure with a high success rate. The surgeon makes a small incision in the groin, locates the testicle, and gently brings it down into a pocket created in the scrotum, securing it with a stitch. Recovery is usually quick. Your baby will be uncomfortable for a few days, but major complications are rare. Step 5. Plan for the long term. Once the testicle is in the scrotum, your job isn't over. Your son should have annual checkups with his pediatrician to ensure the testicle stays in place and grows appropriately. When he's old enough, teach him about testicular self-examination. This is not about fear. It's about empowerment and lifelong health. Let me address the guilt question. Did you cause this? No, you absolutely did not. Undescended testicle is not caused by anything a mother did during pregnancy. It's not from your diet, your stress, or anything you were exposed to. It's a developmental condition influenced by genetics and hormonal factors during fetal life. Risk factors include prematurity, low birth weight, and family history, none of which are under your control. Release that guilt completely. What about the long term? Will your son be able to have children? Will he be healthy? For unilateral undescended testicle treated early, the prognosis is excellent. Most boys grow into men with normal fertility and normal lives. The key is timely surgery. For bilateral cases, fertility may be more significantly affected, but early intervention still makes a major difference. And regarding cancer, the increased risk is real but manageable with education and regular self-exams. Most men with a history of cryptorchidism never develop testicular cancer, but they should be aware and proactive. Remember Amanda's son Jackson? He's now 3. His orchidopexy was done late, but his testicle is in the scrotum and growing. He'll need monitoring as he grows, semen analysis when he's older to check fertility, testicular exams throughout his life. The road is a little more uncertain because of the delay, but he's healthy and developing normally. And Kevin's son Marcus? He's 6. Both testicles are normal size. His prognosis is excellent. Kevin tells every new parent he meets, "Don't wait. There's a window. Find out what it is and act." This is what I want you to take away. An undescended testicle is common, it's treatable. And the single most important variable in your son's outcome is timing. You haven't missed anything yet. But every month that passes after 6 months without action is a month of unnecessary risk. You are not overreacting by seeking answers. You are not being pushy by asking for a referral. You are being the parent your son needs. If this video gave you the clarity you've been searching for, hit like. It helps other parents find this information before that critical window closes. And if your son has been treated for an undescended testicle, or if you're a dad who had this as a child and want to share your experience, tell me your story in the comments. Your words could guide a parent who's right where you once were. Next, watch the video on your screen. It explains the single kidney diagnosis and the 48-hour plan every parent needs. If your child has multiple concerns, that video is your essential next step. Your son's future is still wide open. You just have to take the right step at the right time, and you're doing that right now.